Hi guys, Heather here. Some of you have probably noticed that some of your patients don't really like to drink fluids, and I try to encourage my patients to drink fluids, so I ask them what they want, and some will say beer, gin and tonic, or tequila. Well, okay, sure, I would give that to you if I worked in a bar, but right now your choices are milk, water, juice, or Sierra Mist. Some patients will drink like a few sips of water and then they're done for the day. And then there are other patients who will drink, pretty good amounts of fluids and still not be urinating. So if Betty isn't urinating by the end of my shift, like within 6 to 8 hours of my shift, then I'm gonna have to scan her bladder to see if she's retaining any urine or just dehydrated. I've been talking about bowel and bladder a lot lately. Don't let me talk about it again for a while, okay? But in the hospital, not a shift goes by when we're not talking about urine. We have to monitor it and measure it and test it, so it's pretty much a daily subject for nurses. So a patient should be urinating around 30 cc's an hour, and how would we really know that unless the patient had a Foley, right? On non-ICU floors, we don't really pay too much attention to the hourly output. So if you times it by 8 hours, your patient's gonna need to void about 240 cc's per 8-hour shift. If your patient's only urinated like 100 cc's that shift or nothing, you can always do a bladder scan to see if there's any urine in the bladder and then notify the doctor. So the doctor might order something like a 500 cc NS bolus or put them on like IV fluids maintenance dose of 75 cc's an hour to keep them hydrated and urinating if your patient's the type to not really want to drink a lot of fluids. And if they're retaining a lot of urine in their bladder, they're probably going to have a Foley catheter. That just can't be a pleasant process. But speaking of Foley catheters, back when I was in the hospital many years ago with a pelvic fracture, my sister was trying to convince me to get a Foley catheter because she had one at one time and she's like, they're really convenient and you don't have to use the bedpan. And being in nursing school and knowing the process of inserting one, I was like, what? No way. Me and the bedpan will do just fine. And yes, they are convenient. I'll agree with that, but I'd just rather be the one putting them in. Some patients, like your congestive heart failure patients, who tend to retain fluid in their lungs and body tissues, probably really don't need any fluids, but maybe need a little Lasix to help them out. Lasix helps the patient to get rid of the excess fluid from the body, and although I've never had Lasix myself, I always imagine it to be like drinking a large soda, and then your bladder feels like it's going to explode and you pee like a racehorse. Speaking of peeing in racehorses, a doctor once told me that they actually give Lasix to horses before a race, I guess to help improve their performance, and they pee like gallons of urine, and also it somehow like prevents nose bleeding when horses like overexert themselves. Kind of interesting. So I guess I can kind of empathize with them when the patient's trying to jump out of bed and rush to use the restroom. I think we've all been there in some way, right? Well, friends, those are some ways to help take care of your patient's lack of urine issue. Thanks for watching, and I'll talk to you soon, Kay? Bye.